And if the same convenience can make a big difference, then you can trust me. Not just where you should be. That is JP Mega, 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 Mega. The one-stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun. Shop if you're not a if you're so shop. Cater to everyone. What a happy place, happy place. Oh, JP Mega, 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 Mega. The one-stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun. Shop, cater to everyone. What a happy place, happy place. Oh, what a happy place. You just pick some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Pomole where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience. Jolly's Pharmacy is bringing vibes to
Good morning, good morning, good morning, and welcome to another episode of Health Vibes. We are here with you as usual on a Wednesday morning, your Jolly's team, bringing you a health education talk show with a little vibes, a little, a little something. This morning, joining me in studio is Jacinta Fagan. Jacinta, good morning to you.
Good morning to you and good morning to our listening audience and those viewing us live. How are you doing this morning?
I'm good, Jacinta. It is the month of October. First of all, happy birthday to all the October borns. We have an October born guest in the house as well, who we will be interviewing shortly. But happy birthday to all the October borns. But it is the month of October, which means the independence season plus the the cruise ship season. And those two things mean for me a lot of stress on the streets of Roseau as a driver. So I am a little, this morning when I saw the traffic and so on, because of the cruise season has opened this morning. And of course, we experienced quite a bit of traffic. And I said to myself, oh my God, the stress has begun. As a driver, it is a stressful time. So Jacinta, that is my thing this morning. It's the stress of navigating the roads in the busy season.
I can tell you, I sat on a bus this morning for over an hour.
Wow.
And it was not very pleasant.
Wow.
And of course, everyone was very anxious and frustrated. And when we reached the port area, I was like, oh, yes, cruise ship. So, yes, definitely you need to leave home much earlier than your normal time.
Right. And just brace yourselves because, as I said, cruise season, but as well, the independence season, we expect, of course, our Dominicans who live abroad as well as foreigners to be coming to Dominica for the independence celebrations for the 25th World Creole Music Festival, which happens next weekend, the 24th to the 26th. So we do expect a big influx of people, which means that it will be busier still. So if you're a driver, you need to, take your time, be patient, because you do anticipate that this season will be very hectic on the roads.
And we expect the police force, to play their role.
Yeah, I hope so.
To guide
the
very bad drivers out there. And also not just for safety and precautionary measures.
Yes, I do hope so. But yeah, Jacinta, it is, a very bright Wednesday morning. I do understand we expect some rain later on because we're being impacted by a trough system. But I'm happy too that we did not get too much bad weather from the passage of Tropical Storm Jerry last week Wednesday when we were on. We had just heard from the Met Office and so on in preparation for the passage of that storm, and it wasn't that bad. And so as we approach the latter end of the hurricane season, we continue to give thanks and praise to God that Dominica has thus far been spared from any major storm, throughout this season. So we just, look at the weather weather. I know people are looking at the weather and looking at the rain predictions for the next few days. And some people are talking about, will it be Creole in the mud as per usual at TV Lash Creole next week? We do know as Dominicans that this particular season is the rainy season, and we tend to get rain, and we tend to therefore get some labu for our events. So people are looking at the rain. Let's see what will happen. But festive season and Jolly's is well prepared. Just if I can tell you that I know in this season and with all the Dominicans who will be returning home, people expect certain foods that they associate with the independence season, and they associate with Creole, and Dominica picks and your akras and so on.
Yes, in the mix, definitely.
And Jolly's has this big promotion going on. I want to highlight that it is on Brinto oil, and the promotion right now is that if you buy an 18-liter tin of Brinto oil, you get a free 25-pound bag of Nelson white flour. So for all the vendors and so on, and people who are prepping for the festivities next week and for the independence season itself, your supplies, at least the oil and the flour, you can get at Jolly's.
Someone actually came to me yesterday. She's a caterer, and she said, I couldn't get flour last week anywhere. So she was on a hunt.
Wow.
So she's booked for the season. So I think she'll be very pleased to hear about our promotion to get this amount of flour and oil. So yes, Jolly's is the place to shop.
Of course.
Get all your supplies so that your baking, your cooking will be as smooth as possible.
Right. And you can get that at Jolly's Pharmacy Wholesale, the wholesale department
on King George Street.
Yes, JP Mega, as well as if you're in the north, JP Portsmouth. So if you want that Brinto oil, it's on special, the 18-liter tin. I understand that last week the 10-liter tin went on special and it sold out in just a few hours. So now the 18-liter tin is now on special. It will retail for $167.50. So you need to head on down, JP Mega, Jolly's Wholesale, or in Portsmouth, Jolly's in Portsmouth, get that 18-liter tin of Brinto oil, and you're going to get a 25-pound bag of Nelson flour on this promotion. So that's a great deal. And for the people coming home, Jolly's has not forgotten you as well. Next week, Friday, the 24th of October, there will be a welcome home market. Now, I have to say, this is a fabulous idea. The Welcome Home Market is going to feature some local manufacturers as well, of course, as Jolly's manufacturing, and the products that we know our Dominicans living abroad like to stock up on before they go back. So things that you don't maybe get overseas, and you're coming to Dominica and you're saying, boy, I want this oil, my coconut oil, my castor oil, my whatever oil. I want my Babyliss, right? I want my oil of Ojas for my pain, my aches and pain, So different products from Jolly's manufacturing, as well as some other local manufacturers such as Shore Lifesaver, the Cassava Man, Nature Blends, Mama Shiva, Alozi, Mrs. Rice, Kako Sticks, Cameron's Leather Sandals, Heaven Sent. So a lot of local products. So it's a one-stop shop on the 24th, the Welcome Home Market. The location is the Old Street lot. Jacinta, I believe that is the lot where we do the cardio jams, right? So Cardio Blaze is labeled next to Party Shack, right? So the Welcome Home Market. So when you descend and you're in Dominica, of course you're coming in, a lot of people coming in from this weekend, you're there and you want your products to go back after the season. the 24th, Friday the
That's
24th.
next Friday.
That's next week Friday from 9 a.m. to 4 p.m. The Welcome Home Market is the place to be. It will be Jolly's lot. That's Cardio Blaze lot right there on Old Street next to Patty Shack. And all those local products will be available. So you can stock up. So you don't need to tell people when they come in up, bring some bring some cocoa sticks for you, or when they coming up, make sure to bring some nutmeg and some spice, right? You can head on down to the Welcome Home Market and stock up yourself so nobody can cut style on you. All right. So you're going back home with all your local products, fully stocked. You know, you know how it is in terms of carrying things to and from based on your luggage restrictions. Yeah, so Welcome Home Market, October 24th, next week Friday. If you're visiting Dominica, if you're a local visiting, coming back home, if you're a foreigner as well, you can check that out on the 24th. All right, Jacinta, we have a guest in studio. We have a very interesting topic lined up. I see our online listeners have been popping on. And if you're listening to us on the Facebook page of Q95 FM Radio or on the YouTube channel, a special good morning to you. I ask you please to share the live because we do have an interesting topic lined up. We have our guest waiting who will introduce in a bit. So please share the live. Tell a friend to tune in to Health Vibes. If you're listening on radio, you can do the same. You can go outside and you can shout, hey, Health Vibes is on. Put that radio on Q95 FM, the big station. We're right here. We will be back after a few short messages, and then you'll get to know what we're discussing this morning. We'll be right back.
Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.gm. Jollies Pharmacy, leading the way in healthcare. Woke up this morning feeling risky. I had been patients to call in sick, but I end up in Jolly's Pharmacy. And don't think that she Jolly's fix up my immune system. Me feeling fit and strong now. I'm ready to work like it on any mission. If you see me again, Jolly's Pharmacy is number one. Jolly's Pocket. We cater for everyone. Jolly's Pocket. It's the immune system. Jolly's Pocket. Yo, Dominic is about the box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy, then boost me up real quick. Jolly's Pharmacy, leading the way in healthcare. Oh, and if the same convenience make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Shop if you're not happy, so shop. It's to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Shop if it's to everyone. What a happy place. Oh, what a happy place. But just fix some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongbode where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience. Jolly's Pharmacy is bringing vibes to health with Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts Trudy Kristen and co-host pharmacist Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor, and not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
And we are back with you. As I promised before we went on break, we have a guest this morning in studio, and we have an interesting topic lined up. Joining us in studio this morning is Mr. Fael Lander, and many people may know Fael for a lot of different things. They may know him from his work in JCI Dominica. They may know him as a Calypsonian. They may know him as someone affiliated with Red Cross at some time, doing first aid trainings and so on. They may know him, affiliated with pageantry. But I don't know how many people know Fael Lander. Maybe a lot. I maybe am mistaking people's knowledge, but I don't know how many people know Fael as a nurse. Nurse Fael Lander, good morning to you.
Yes, good morning to you, Trudy, and good morning to you, Jacinta, two very familiar faces. Makes me a lot more comfortable. And I want to say good morning to the listening public of Q95 Radio. And as Trudy would have alluded to, this is a very important topic considering the season that we are in. And just to let persons understand that what we are here to do is bring knowledge and to alleviate any and to bust some myths as well today. So this is where we are going to go. And I'm here to answer any questions as best as I can, or at least direct you to where you can find the answers.
Right. So we haven't said what the topic is. And I said Fael is a nurse. He's introduced himself. Where is Fael is based right now in the accident and emergency unit of the Dominica China Friendship Hospital. So he's an A&E nurse. You know that place that we call casualty. Many of us we still
don't like that word.
Yes, many of us still say casualty, but the proper term, the accident and emergency department of the Dominica China Friendship Hospital. So, Fael, this morning we really want to get a good grasp on what can possibly or what should necessitate you visiting our good folks there at the A&E department of the Dominica China Friendship Hospital. I will start off by saying, interestingly, I have never in my life gone to the A&E department of the hospital.
Wow.
Never in my life. So
that's a good thing.
Yes, I have been once to take someone, but I have never to take someone who needed to go, but I have never gone for myself for any care. So I will tell the listening audience, it's not like as if I have not had illnesses or I have not had health struggles and health situations. So I want to find out if my avoidance of the A&E department has been good, or maybe were there situations where I should have gone to the A&E and I failed to do so. I didn't die though, so who knows? I didn't die. But Fael, it is, I think, necessary for people to first understand what is the accident and emergency department there to do. Okay. So give us an outline of what you all deal with.
So now I just want to also preface this by saying that I don't want persons to think of this only in the frame of mind of the Dominica China Friendship Hospital, because we do know we have listeners overseas.
Oh, yes.
So we're gonna just frame it how to use an emergency department. In Dominica, we call it the Accidents and Emergency Department. Within our health centers, each health center, I would say, to the best of my knowledge, has subdivisions that are called casualty. That's where the name comes from, in terms of casualty. And it also transitions from our link to the British system, where the A&E department once was called the casualty. Okay. So as a result, from the war times where persons would be injuries, so they would have a section of the main hospital where casualties would be brought into, hence the term casualty. So as a result, and over the years, the emergency department, emergency rooms have transitioned, and there's a lot of study that goes into it. In fact, there's an entire specialization within. So doctors can go and become emergency department doctors. Nurses as well can go and become certified as trauma nurses. So there's a lot of research into it. But down to the root of it all, the emergency department exists for serious, life-threatening, urgent conditions.
Serious,
Life-threatening,
life-threatening.
urgent conditions.
Okay.
So as a result, you need to think of, okay, when I'm going to the A&E department or I'm going to an emergency room, do I fall within those categories? And to further simplify it, we within the health system internationally follow what we call the ABCs of life: airway, breathing, circulation. So airway meaning that the passageway where air passes through. So right now we are able to talk, so our airway is clear.
Yes.
Right. Breathing, where we inhale and exhale, we have that gas exchange. Oxygen comes in, carbon dioxide goes out. Is that functioning as it should? Circulation has a two-prong, where we have circulation is your heart functioning as it should, is it pumping as it should, and also circulation in terms of our blood system. So if you have a cut source or that causes a break in that continuity, that can also put you within those categories. So really and truly, some examples that include of the things that I've mentioned include severe chest pain, shortness of breath. So the severe chest pain can be indicative of having a heart attack, but for some persons as well, can also be as simple as having heartburn.
Acid reflux.
Acid reflux. However, it may necessitate in that moment for you to be able to understand that is what I'm experiencing something that is very severe, or it might just be a symptom as a result of a pre-existing condition. Because being a nurse, and I'm a relatively young nurse in the system, I would say, in comparison to my predecessors, we have a lot of persons who have pre-existing conditions who ignore or rather do not adhere to the advice of their healthcare providers. And as a result, for example, persons who have what we call GERD or acid reflux, right? They will eat what they want, especially during the season. So the oily foods, the spicy foods, you name it, everything that they're not supposed to eat, they will eat. And the body, because of its already compromised state, will react accordingly and put you and make you feel like as if, because honestly, I've seen patients and anyone who has heartburn can feel and tell you, listen, that burn can feel like, oh, am I having a heart attack? Yeah. So it's can indicate it, but you need to also know and understand that if you probably take 2 Tums or 2 antacids, it can resolve your issues.
I'm happy, not to cut you short, but I'm happy that you brought up those points because we've had customers come in and even co-workers as well that express those type of symptoms, saying, what's in my chest. And when we question them as to if they've had any other pre-existing conditions, especially GERD, they say, yes, have you eaten? What do you eat? When last you ate? What, rightfully they'll say, oh yes, I ate late last night, or I haven't eaten for the morning, or what I ate would further, irritate their lining and so forth. So knowing the signs and symptoms and being honest with yourself and adhering to advice, as you rightfully said, would make a difference and help to differentiate whether it is really a heart attack or a simple condition that can be treated with adherence and medication.
And additionally, and we spoke about this, so that would fall within the circulation, where it might be the difficulty breathing as well, fall within the B and the C.
Right.
Also, the other C I told you about was the circulation in terms of your
blood vessels.
So you have, and I am very happy, and I hope I'm making you proud, because Trudy was my AMP teacher at college, so I do hope I'm making her proud. But your circulatory system falls within your blood vessels. So if you're cutting that coconut and I'm just using common injuries that I've seen over the years, yes?
Okay.
So person's trying to cut the coconut to make that fresh coconut milk, and they miss and they cut, and the cutlass hits them in their hand, and you have a very large gash, or you may have a partial, what we call partial amputation, where a piece of your finger may be coming off. These are things that happen, guys, because again, in the rush of trying to cook and trying to prepare food, persons may get injured.
Of course.
And also alcohol is being taken in, and persons sometimes arguments get very heated. So you have some fights that may end up having persons getting injured. So as a result, these are certain things that may happen and may warrant you to come to the A&E. So now another thing is the stroke symptoms. So we have had a lot of conversation over the years, and especially in the United States and even in the UK, where there's a lot of conversation on stroke. What we call in the health system as a cerebral vascular accident or a CVA, but colloquially it's called a stroke. So somebody who may have, and we won't go too deep into it today because that's a whole topic by itself, but having symptoms of a stroke where we talk about you think fast, so your face will have facial drooping, their arms may feel tingling, and they may not be able to raise one of their arms, their speech may be slurred, and we want to also be timing how the time frame of that happening.
Right.
Another thing, patients may go unconscious or have seizures. These are things that need to be monitored very closely. And there's a difference between someone who has a seizure condition, who has a seizure, and also someone who's having a first-time seizure. Okay. All first-time seizures need to come to an emergency department because we need to know why you're having a seizure. Exactly. So some persons who have pre-existing conditions, who, as we call fits, they sometimes will tell you, I'm going to have a seizure, and they'll drop down and they will roll on the floor, and then you're wondering what's going on. Might just be they're having a flare-up of their condition, need to take their medication, or they may need to have it tapered and may need to actually go to hospital.
Right. And on that note, again, when it comes to medication for people who suffer with seizures, the medication needs to be evaluated from time to time. And when File said tapered, it means a dose may have to be changed, either higher, lower, or the frequency as well. So if you are a patient or you are taking care of one who suffers with seizures and your refills are coming to an end, please not wait until you are on the last dose to make an appointment to see your doctor because of their very narrow therapeutic index, which means it has to be calculated properly. We cannot just refill like it's a maintenance meds for blood sugar or
blood pressure.
Blood pressure. So those medications have to be taken correctly and evaluated very carefully before it is being prescribed.
And especially now, and I sometimes people tell me I'm a foodie, so I'll tell you straight off, especially now during this season, we have to be extremely careful when it comes to allergic reactions.
Yes.
Now, a lot of people, and I am a victim of it as well, found out that they are in fact allergic to shellfish during the Creole season. My entire life, I've loved my crab, I've loved my shrimp, I've loved eating lobster and all the good things. And 2 Creole seasons ago, I had crab callaloo, and I had a severe allergic reaction. My face started to swell up. I started to wheeze. My throat, wheeze meaning like the high pitched breathing sound, and I was feeling like my chest was closing. It got difficult to breathe, and these are things that can happen. So all of what I've listed above are examples of when you need to absolutely go to the A&E. And this is something that you need to take into consideration because. And just to preface one of the things I was talking about, I was going to talk about as to when not to go to the A&E. Because your medication refill is not to be done at the A&E department. For one reason, and I'm going to explain why. It is not because the people there or the practitioners don't particularly have time to do so, which may be the case, but rather, especially for persons who have long-term or chronic illnesses, your hypertension, your diabetes, your cholesterol, your epilepsy. This doctor does not know you from Adam.
Doesn't have your medical
history. He doesn't have your medical history.
Right.
So you coming to the department with your, doctor, I on metformin, and you're waving your plastic bag in their face. But why are you on metformin? Right? It's because there are some women who are placed on metformin for PCOS. They may not necessarily be on metformin for diabetes.
Right.
They may not necessarily be on metformin. And a lot of medications have multi-use.
Yes.
Even off-market use as well. So you have to be very careful as to going to the A&E and for the lack of a better term, wasting your time, because it leads to the next point. When you come to the emergency department anywhere in the world, the first step is what we call triage. It comes from the French word triage, which means to sort. So when you come to the department, the hospital staff is going to take a look at you. They're going to talk to you, have a conversation. Why are you here today?
Okay. I'll pause before you go into triaging, which I really want you to get into. Let us just reiterate for the listening audience. I do see we have people popping on now. A lot of new listeners have popped on. So let us reiterate, why should you go to the A&E? You should go. It is necessary for you to go. You detailed a nice way to look at it. A, B, C. Anything obstructing or anything to do with your airway being obstructed, your breathing being compromised, and your circulation, that blood flow, or your heart having an issue. You also detailed stroke symptoms, having a seizure for the first time, right? And you also have gone into some of the other the emergent things that can happen in terms of an accident, an injury, a cut, where you may need to go. Now that people understand why you should go. So now that you're in the A&E, right? So you got or file, as you mentioned, allergic reactions, right? Allergic reactions. So let's follow through. Here I was, and somebody, by the way, file said it's a bad crab here you ate. Why you got the allergic reaction? But let's follow through on the allergic reaction detail. So I'm there. It is 8 p.m. and I ate a crab callaloo, and all of a sudden, after I ate it, my face started to swell, my mouth or whatever. I start to have difficulty breathing, and I am rushing. Take me to the A&E, which you have said is fair, because this is a reason to go to the A&E. So I am there now. I arrive.
Yes.
Somebody brought me, and I rush in, and what happens? And I want you to go through that process now of what happens in terms of the process of triaging patients very carefully, because this is the part I feel that has a lot of, people don't understand what happens. And so there is a lot of, I would say, dissatisfaction about the process because of maybe lack of understanding or not knowing. So I'm there with my swelling face and my difficulty breathing. What's the process?
So first things first, you will be greeted by the nurse who is present, and they'll ask you, what are you here for?
Okay.
Now, because of the symptoms, and some persons will have visible symptoms or very, very visibly, as you say, you're having allergic reactions, so your lips are swelling, your face is swelling. Patients of that category would be seen of higher priority immediately, rushed, sometimes based on the process would be immediately rushed to where we call the observation area. However, the triage system is, and I want persons to understand this is not something that is Dominica based. This is not something that is unique to our system. This is something that is done internationally, wherever you go to any emergency department. When you come in, the first thing they do is determine the severity of your illness. And that can only be done by asking questions.
Of course.
So don't fight the nurse, don't fight the person at the front desk that's asking why are you here, because we need to know. We need to know so that we can help you and gauge. Because imagine you coming with an allergic reaction, right? And somebody coming for prescription refill, right? And I want to put those two into perspective for you. Allergic reaction, as Trudy said, your face is swelling, you cannot breathe, your chest tightening, you literally feel like you're dying. Right? And someone come and tell you, Doc, I need a prescription refill. Not saying that the prescription refill is not important, not saying that we do not do it, but it will not be a priority compared to the other patient who has come to the hospital or has come to the emergency department. Nowhere in the world. So if I go to work in Bermuda, go and work in the US, go and work in the UK, no matter where it is, this is the same mentality that we brought up,
Of
because
course,
it's not
and that's fair.
first come, first serve. It is, as we colloquially say, worst come, first serve.
Worst
come, first serve.
served.
I think that's
Exactly.
important to repeat. Worst come, first serve. So that's the
Right.
protocol that you're following,
Right.
right? So the worst or the most severe will be
Attended
seen
to.
or treated or sent into the observation area.
Yeah. So you
first.
prioritize based on
Right.
urgency, not your
Right.
arrival time.
No.
Okay.
I come there since 6 o'clock in the morning. And what is great about our hospital, and I want to send kudos to the management of the hospital, is the fact that within the past years we've established within the A&E department what we call the minor cases unit. So cases where persons, and this operates between the hours of 8 and 10, where persons who come to the hospital and it's based in the A&E department, they come to the hospital and they really don't need to be there, but they are here already, as opposed to sending them back to another health center, send them through the system, which can have its delays. They are seen within the hospital immediately. So the minor cases unit was established for just that. However, sometimes due to staffing limitations, that the unit may not necessarily have a doctor at the time, but so it can have its strain, especially now during this heated season, with the influx of visitors and the influx of potential for illnesses, and we have to be very mindful of those things.
Of course.
So as a result, the most that we can ask from the patients is patience, because I mean, you have to be understanding that everybody who comes to the A&E thinks that their emergency is the worst case scenario.
Right. I can imagine.
Everybody. So from the time you reach inside,
I died.
But does not necessarily mean that may not be the case, or it may be the case.
Right. Again,
and that's why
assessment.
the professionals are there.
Right.
We look at you, we talk to you, we assess you, and do what we have to do to make sure that the care that is provided is the best possible. Because I've heard persons come to me in the past, and even before becoming a nurse, they'll come and tell me, I went to the A&E because I had a fever, and all they gave me was paracetamol. And all I could answer them in the moment was, well, you have nobody but yourself to blame, because you passed your health center, you passed the pharmacy, and you passed, years gone by, and Trudy said it, I very rarely use the A&E as a patient myself, not only because of my knowledge, but as an asthmatic, I would have only gone to the A&E when I was having an asthma attack.
Of course.
And that's where, that's on the breathing.
Right.
So, right? So we see where the links start to come, right? But my parents growing up hardly would bring me to the hospital. When you have a fever, you take your tepid bath, you get your paracetamol, you sit down under the fan, they bathe you in Vicks, and you sort yourself out.
Right.
But now we are forgetting a lot of our home remedies. The relationship with the pharmacy, unfortunately, is not what it used to be. I remember my father going to the pharmacy in the past, and Mr. Jolly, may he rest in peace, would say, just come. And a concoction would be made and set up, or he'll pull certain things off the shelf,
yes.
because that's the whole concept of over the counter.
Of course.
That you can go to your pharmacy, you can have a conversation, and they can provide to you the necessary medications,
right.
or assistance, or even advice.
Yes.
Because I'm sure there have been situations where in the moment you're talking to a patient who comes to the pharmacy anytime, I think it's best that you go to the hospital.
Yes, I was about to say that.
Yes.
We have had situations where the time you've not wasted, but you've come to us, you needed to go to the
hospital. Okay.
Especially as you indicated, for very severe cases, where they are not able to breathe properly. They have this very excruciating headache, and not just any headache, but a headache that has been consistent for the past couple of days, and they have pre-existing conditions as well. Their pressure levels are very high, their sugar levels are very high. So you're basically walking at risk of collapsing, you know. So in certain cases, we definitely do advise them to go to the emergency care. Not go to a doctor and sit on the office. Go to the accident and emergency department.
And importantly too, when you're coming to the or going to the A&E department rather, you need to also be mindful. We out with friends or we out at home, because now it's a lot of time with family gatherings and having fun. The desire to have an entire group of people coming with you to the A&E department sometimes might be very high. So you see persons coming crowding the department. At that moment, you need to be very careful, because imagine if sometimes the hospital or the A&E department within a shift can see upwards of 30 to sometimes 40 patients. And imagine if every person comes with their entire family.
With an entourage.
So
it crowds up
the department, it crowds the patient, it raises the anxiety, it causes, and imagine the staff now having to deal with the noise, plus the anxiety of the patient, plus all the other things that were going on in that moment. Please be mindful of that. I understand, trust me, I understand the frustration, I understand the fear, and the pain that the person may be in, and the desire, and seeing your family in pain is a lot. And in no way am I saying that the concern should not be shown, but just be mindful and be patient, because things will happen. You have accidents that will come in that will take priority, and the staff now have to share themselves and share the resources and call in extra staff, and these things will happen. But as the public, can help to alleviate that if you know that what I'm gonna do is I don't have what I have can wait. I've heard people say to me, boy, I feeling sick, I think I'll just go in after work.
So let's talk about that file. Let's talk specifically about some common situations where you can seek an alternative path to treatment, and you don't need to go to the A&E. Of course, you've outlined why you should go to the A&E. So these things require you to go for sure. But what are some common situations that you can treat at home? And specifically, like I asked with the allergic reaction scenario that I posed to you, let's put time into context. I would assume, because I know how these things go, that a lot of visits to the A&E happen at night, when people may feel like, that's the only place that I can go. So let's go for some typical things maybe that you've seen that could be dealt with without going to the accident and emergency departments.
The flu.
The flu. Okay, so respiratory illness like the flu.
So now I will say that, and it's a ballpark, the flu, because there are, in fact, for example, so persons who have pre-existing conditions like asthma. So when you do catch the flu, you can have what can happen is that you will have a worsening of symptoms because of your already compromised respiratory system. So you have the flu, you have your mucus is being developed in your lungs, and now you have worsened, decreased air entry, and now you're having wheezing, and you can't breathe through your nose, can't breathe through your mouth. Patients like that need to come to the A&E. But you were out partying, Creole Festival, Friday, Saturday, Sunday, Monday, you feel beat up and your nose runny, and you don't want to go to work, you have a little bit of a headache. The A&E is not the best place for you.
Right.
As a result, and I want to also say this, that patients come to, and any patient within our healthcare system need to recognize, sick leave is given by doctors based on their discretion.
Yes, of course.
And based on your assessment. So coming to the A&E does not guarantee
that you'll get sick
you're
leave.
going to get sick leave.
Okay.
So this is another thing that, in my experience, I've seen people come straight up to the front desk and tell me, I come for sick leave. So what's wrong with you? Oh, I think I have the flu. Right? I was just as shocked, Jacinta. But this is the reality. And so now a patient like that, you sit down, you write for them, and they now are occupying a space, and these are the persons or the types of patients that will be very upset with you. Oh, so long I sit down there. I did since 8 o'clock in the morning. And again, putting into perspective, you have a patient with an allergic reaction has come to the department, and you expect the healthcare provider to leave that patient just to come and listen and write you a sick leave. We have to be practical. We have to be fair. In terms of timing, you have different levels of allergic reactions. You have persons who will have full-on symptoms, as we've said, that sometimes, and the older you get, and even the older the allergy gets, I will say, because we have some persons who have been allergic for years, and the more they get exposed to the allergen, the response in the body, so allergic reaction is a response in the body, gets worse. So it's almost it's actually an immune response similar to that of when you get the flu and you have fever and those types of things. So patients may have different levels of responses. So it can be like, so for me, I knew initially in the past that I've had this small itching around my mouth. So you have, or even in your hands. So symptoms like that can be managed with over-the-counter antihistamines. You go to your health center, or even to the pharmacy, Jolly's pharmacy, to ask and say, hey, I am having these symptoms. And one of the most common of them is Piriton. One Piriton can knock that out for you. If after having taken that first dose, the symptoms either persist or even worsen, then you need to come into or go into the hospital.
Okay. So you're saying not to come in if you have some mild allergic symptoms. So you mentioned the flu. And now you're mentioning, allergic reactions that may be mild to moderate, and that you can possibly get something at the pharmacy for. And then, of course, if it persists, then you think of the A&E, right? Okay, so those are two scenarios.
And then another thing is, for example, so we have children as well, particularly smaller children. So we have persons who, so everything I've listed above, the same thing that you do for adults, you do for children. Once you have breathing issues, once you have circulation issues, once you have airway issues, bring baby to hospital. That is cut it short. Where it gets a little bit iffy is when it comes to the fevers.
All right.
So a child can have a fever, and because of the potential of what we call febrile seizures. So febrile seizures occur in smaller children when fevers get very high. It may not be an indication of a seizure condition or seizure disorder. It's just the body's reaction in the moment. However, as a result of, if you have a child who has a febrile seizure, no questions asked, bring them to hospital. Right. But it comes back to the conversation we were having a bit earlier. Parents need to be mindful of, once you have a child in the house, there are things that you need to have. Essentials. Paracetamol, antihistamines, or your Benadryl, expectorant and elixir, and also cough syrup. These are things that, before you even think about anything else, because as well as your vitamins and those things, but paracetamol, your antihistamine, and your cough syrup. This will save your life and save you an unnecessary trip to the hospital.
Parents, I hope you've heard that.
Yes. And I agree with you, Fayo, because many times parents would come in with their child and they would present a fever. But something else I want to add on to what you're saying is that with any medication, for it to work effectively, you need to give them the correct dose and the frequency.
Yes.
So paracetamol is a once a day medication.
Yes. Or once one off and it will be done.
And
So
it
I
will-
give again paracetamol this morning and it didn't work. They go
And it's
school
night.
and I mean, and we did so well during COVID. Honestly, we did so well. When people have flu-like symptoms, we used to keep them home, and these are the things that we can do to help to protect children and protect each other. And the other thing is fever alone can be managed, but when fever comes with other symptoms, especially in children, especially children who have stiff neck. So when you have a fever and a stiff neck, it can be indicative of a very bad, a very serious illness called meningitis. So we have to be mindful of that. Also trouble breather, fever along with trouble breathing, or fever with seizure, and fever with persistent vomiting. And all of those things can preface and make you think, okay, because of them being smaller, the potential of getting dehydrated is higher, especially when you have gastric symptoms, so vomiting and diarrhea. Now that I'm saying this, and I will shoot myself in the foot if I do not say this before I leave and our time runs out. But during this festive period, I want the persons, as much as you love food, just like as I do, and I know that the environmental health division does an amazing job, and the health promotion unit does an amazing job in terms of educating the public and educating persons as to
food handlers
in terms of the food handling. But people, please be mindful, because no matter how clean the food is, if you yourself are not practicing the hygiene and practicing good hygiene, you put yourself at risk. You cannot be shaking hands and dancing and all over the place, and as soon as you get the bakes, you just put bakes in your mouth with your dirty hands. You go to the bathroom, the stalls are being used by multiple persons, you don't know if the toilet was flushed properly. These are things that can happen. And there we can go down an entire tangent about how the process can go on in terms of how gastroenteritis can be attained. But all I will say is that in the initial stages as well, you have that diarrhea, that vomiting, that those symptoms. You can go to your pharmacy and get something over the counter.
Yes.
You can.
Okay.
You can.
When they come in, again, we ask them what they're experiencing. We do have antidiarrheal medication. We have rehydration salts. We do have medications that could help with minor cramping. We do advise our patients as well what to do, what to stay away from. And just one more point to what Fayal said, not just babies but elderlies as well are at risk for dehydration at a much higher rate than middle-aged individuals. So keeping all of those in mind, and some people do not take our advice and they go drinking and eating all what they want during that phase, but your body needs to recover. You need to treat it properly, and then as time goes on, as the body heals, then you can go back to your regular dieting. But yes, we do have medications available to treat
and of course, Jacinta, do you as well have your electrolytes, like Pedialyte and things for right?
Yes.
So this is an important point. I want to pause to just recap on these things that could possibly affect you, particularly, the festive season is approaching. So Fayal has been really looking at these things that are common in this time, which is good, but some things that you can treat with a visit to the pharmacy or a visit to your health center, and not necessarily go to the A&E. So we've spoken thus far about the flu, or minor respiratory symptoms. We've spoken about minor allergic symptoms. We've spoken now about gastroenteritis or your vomiting and diarrhea, possibly what people call bad stomach.
Right.
I get a bad stomach. I eat something bad, I get a bad stomach. I have a malvat. So that type of thing. We're talking about some of the remedies that you could use and not necessarily rush to the A&E for that. So these are some, and I know these are some common reasons that people do come in to the A&E for sure.
Yes, and I just also want to just put this out there. In no way am I suggesting In no way am I saying, and in no way am I trying to deter anybody from coming to the aid. Right? And what is good for us and lucky for us in our environment in Dominica, some may disagree. We have a public health system in which healthcare is somewhat free, so persons can come and access it at any point in time. However, to save you time and to save somebody who may need the services more than you in that moment,
Exactly.
it is recommended that you try your utmost, because we've spoken about dehydration. So the same vomiting and diarrhea can put you in a condition that requires you to be even admitted to hospital. Yes,
Right, that is true.
So persistent vomiting, persistent diarrhea can
Right.
dehydrate you and
Yes.
drop your electrolytes in your body to the point where you need to be admitted for
For
fluid
IV
resuscitation
fluids.
and get IV fluids. These are things that can happen.
Yes.
But what we are saying is, before you get to that point, Elas Papa Bode, please take the necessary steps, because in healthcare we teach prevention is better than cure.
Yes.
Which now leads to my next point that I want to talk about, because with this festive season we have the potential of persons drinking. No,
The potential, the certainty,
Yes.
the certainty
Some
that
more than
there'll be a lot of drinking going
some
on.
more than others. And the science is out there. We recently had the trauma symposium in Dominica that was held by the Dominica China Friendship Hospital, and I attended as a participant. I was very happy to hear the statistics as well. But the statistics are out there that when you have events such as this, busy seasons, you have the potential of persons drinking a lot of alcohol. And in drinking a lot of alcohol, your ability, your reaction time, your ability to your discretion, all of these things. And this is why persons are told to not drink and drive. So, as much as we would tell them do not drink and drive, they will still drink and drive. And that's the unfortunate thing. But you now put yourself at risk.
And others as
And
well.
others at as well. There are certain things that even the first world hospitals are unable to fix.
Right.
And I will not go down into that path. Death is one of them. Right? So if you put yourself and wrap yourself around a pole and wrap your car around a pole, or you're drinking and you're putting your life and those around you at risk, please be mindful of us. This is a call to the drivers out there, because it's just a wow when you think about the things that can happen.
Okay. I see our lines are going. Let's take a call. I had not opened the lines yet, but let's take a call. Somebody wants to interact with us here on the program. Caller, good morning.
Hello, morning, Julie, Sierra, and Jacinto.
Morning.
I just want to say something or ask a question. Remember long ago, and fairly leave you thing on that. When you had a fever, people used to tell you cannot bathe and thing like that. Now they're telling you go and take a bath. You understand? So that I want to know if that's still exercise that is in order.
Okay.
I can remember long ago a doctor told me once, if you get a burn, not a bad burn, Judy, a little burn, water, just put that on the water, give it. Sierra, is that still in order? Thank you.
Thank you for your questions, caller.
So thank you for those two questions. The science tells you that when you do have a fever, that to help to bring down the temperature, you need to let me put this as clear as possible. So you can take a shower, but you don't want to take a shower that is too cold. So it's not just going into very cold water. All right. Some studies will tell you that you take a tepid bath, so it's not too hot, but it's also not too cold. So the balance of the water. Some studies will tell you that the cold water might be necessary depending on how high the temperature is. So if the temperature is like really, really high, 100 over the 102, 103 climbing, that you may want to rapidly bring down the temperature. But the issue is now when you're dropping the temperature, you don't want to drop it too fast because it can also have some issues in terms of the rebound when as it's coming down. The second question that was asked, and I think it was with regards
to do with burns.
Now, burns are somewhat of a very delicate topic because there's a lot of old wives' tales as to how you deal with burns. One of which would be, and I'm going to tell you all of the things not to do. So I've heard already: put Colgate on it, put flour, put petroleum jelly, put. The best thing you can do for burns, water.
Initial.
So you
minor burns,
burns, cool the burn, and you cover the burn loosely. So you cover the burn, you cool the burn. But once you see that the burn has gotten, so, and it also comes with a little bit of discretion as well, because sometimes hot water will fall on you, and in the initial stage you may not necessarily see the burn, but after the time and after cooling the burn, you start to see the blebs forming. And that may, depending on the severity of it, you may require, and I'm not sure, you may correct me if I'm wrong, there's this particular cream that we advise. The
sulfadiazine?
Yes. Is that over the counter available?
Yes.
So again, this is something that you can go to your pharmacy and speak to your pharmacist about, that you can get it. However, when in doubt, the best thing you can do is come in.
Right.
So if you have a burn, or the person was, for example, actively on fire, or they, or they were exposed and open the flame herself, this is something that you may want to have evaluated by a medical practitioner. Once the top layer of the skin has been removed, you want to also take that into consideration and come in, so it can be looked at, can be the necessary. Because you may need to now have antibiotics, and be placed on antibiotics, which you for sure need to have a prescription for.
Right.
Yes, definitely.
So those are the two things that you have to be mindful of. And I've seen one too many burns during the season as well, because you see barbecues, you have persons cooking food, you have persons who trying to move quickly, and so proper planning can help to alleviate some of those things there. But at the end of the day, the potential is there for accidents to happen, and that's why it's called an accident. And as a result, you want to know create the environment in which you have that knowledge and know what to do. And this is where I will preface to the point that knowledge is something that can only be acquired if you seek it.
Right.
So listening to radio shows like this, and even especially in this season, persons who have first aid training as well can also help to, because within first aid training, they teach you these basic things. What are things to go to the hospital for? What can be managed at home? And everybody should have a little first aid kit at home. I mean, it's the hurricane season, and the first aid kit should not only remain in your hurricane preparedness kit, it should be stocked up for hurricane, yes. But your everyday injuries, because first aid is for every day.
Of course.
It's for every day, and can help to save your life. Because people think that first aid is a replacement of healthcare. It's not. It is the first care given prior to receiving advanced level of care, and can help in some situations. You have a small cut on your hand, you're not gonna come casualty for a cut on your hand while you're cutting your carrot to get a slice. You cover it, and then you continue. So if we, as people who understand the way the system works, and ask a question, you come to hospital, and the most that we can ask is that you have patience with the healthcare providers. Sometimes that you will see somebody coming to the hospital, and the moment they reach, they want to be seen now. They don't care what's going on. They don't have any regard for the other patients that they've met there. And it's a matter of, I feel sick, I want to be seen. And we understand that. Trust me, I don't like to feel sick. So the moment I start to feel a little sniffle, a little cough, I run and I get my vitamin C. I do what I have to do. But and that's actually me being a bad example, because you're not supposed to only take it when you feel sick.
Yeah.
But I digress. But remember that A&E department is not a first come first serve area. You come, first come, first serve. The system is established in such a way that you come in, you are assessed, and based on the severity of your illness, you are treated accordingly.
Right.
So somebody may be seen before you, not necessarily because, he's seen his friend. It's because they are worse than you. And it's not meant for convenience care or prescription refills.
Yes, or not to replace, I should say, your general practitioner or your, so that is the thing. A lot of us, or a lot of people, don't have a general practitioner, or do not have a clinic that they go to for basic health care, so they replace that with the A&E.
But I think it's important to have, if you're accustomed of going to your private doctor, to establish a private practitioner that you are comfortable with
and have a relationship with them.
That's correct.
Because I know of, but I have my general practitioner's number on speed dial. So whenever I have an issue, and I know patients who do,
Right.
And it will come back to the other point that we're talking about. We're talking about the children. You need to establish or have a pediatrician that sees your child, or even a doctor who sees your child. So in those cases there, you can just pick up the phone and have a conversation, and 9 out of 10 times they'll tell you, okay, just do this, just do that, go pick this up.
Right.
And it will help. It will help to prevent that anxiety situation, that problem. And I see our time is almost up.
Yes.
So I just have a few closing messages.
No, we're not closing yet, File, because there are two or three things I want to hit on, before we reach that wrap up stage. By the way, our listeners are chiming in quite a bit. I see someone, File, bigging you up for being very calm when people arrive at the A&E and providing exceptional service, and that's saying that you're a great nurse. Thumbs up to you. So you're getting your kudos there in from our listeners. But File, I wanted to I said 2 or 3 things. Let me try to hit on the less broad one first. Infections. We haven't spoken about that. So let's say someone is in the middle of the night experiencing extreme pain in their mouth, or they suspect, they have an abscess or something, or someone is experiencing some sort of eye, pain or discharge from the eye, or someone is experiencing extremely frequent urination in the middle of the night too. All of these or can be linked to some form of infection, most likely. What is and we have to do this part really quickly, what is your advice to people like that as it relates to seeking care?
I will say this, that most times, and I will say this I hope to be as politically correct as possible, most times those symptoms will not have started in the night.
They might not have started in the night, but that's when people start panicking about them.
So it worsens. So that toothache that you have, whole day bothering you, troubling you. Pain. No, they don't take painkillers. They don't. Oh, just as a toothache, I'll go to dentist tomorrow. But my thing is that the A&E department, and especially ours in Dominica, does not have a dental emergency section.
Okay.
So the most that you might get is just pain management. So might as well, similarly, and even adults. So we talk about how parents should have stuff for children at home, but similarly, adults should at home have your pain management medication. And because of the type of pain, paracetamol alone may not help. So you might need to have an NSAID, which is ibuprofen or even diclofenac, that can be taken to help until you can get to your
dentist. Okay, all right.
But one last thing, and I know we're short on time. The painkillers are temporary.
So you still need to go and get that sorted out.
Exactly. So whole day you're taking it, and then at night when it finishes, or you don't have more, and instead of fixing the problem, you've now come to the A&E just to get a band-aid over the issue. So it's really and truly understanding that you utilize the services wisely. And what the other thing is,
maybe a UTI or someone is
again, the symptoms
eye
will not start
infection
in the middle of the night. And most times it will be that you wake up. Especially for eye pain, you wake up and you touch your eye and you feel like that extra lassie or that extra discharge. these are warning signs before it gets worse. So
Yes.
listen to your body is the
Very
most
true.
I can tell you.
Okay.
So when you have those first initial onset of symptoms, the little burning on urination or the increased frequency of urination, a simple conversation with your doctor or even your pharmacist can help you to get something to help to alleviate that pain prior to you waking up in the middle of the night in such
And starting to
severe
panic, yeah.
pain and panic.
Thank you.
Because those symptoms start most times on onset when you wake up in the morning.
Right.
But if you wake up in the middle of the night with a severe pain, as you've mentioned, then that may not necessarily be something as simple as you may think, and will warrant you to come to the hospital.
And then the last area, okay, thank you. And then the last area I wanted to ask about, it's, as you said, it's festive season. You did give advice as to people and the drinking and driving, and the potential accidents that may happen. But I just wanted you to run quickly through what happens if an accident case, a vehicular accident, somebody has, if somebody has crashed and they're being brought in by the ambulance to the A&E. So it's not they being brought in by people. The ambulance is on scene, they've gotten them, and they're being brought in. How does the A&E deal with that? And how do you all plan for the season where you anticipate there may be an increase in those kind of cases? How do you plan for that?
Well, for sure, the emergency department where I work, well, persons like me are on vacation right now. But
lucky you.
But the department is well managed. My supervisor, she's very wise in the way that she does things. And normally in these seasons, the necessary steps are taken to ensure that sufficient staff are on duty. But at the end of the day, sometimes things will happen. So there is this thing called mass casualty. Once you get to a certain level of patients, there will always be a potential where you may not necessarily have sufficient staff on hand. And this is why we're asking persons or whenever you are out there to be mindful and be careful, because the system has its limitations, and we have to be very careful as to, especially when we have persons who are misusing the system, in terms of minor cases that could be managed at home, and then crowding the A&E. Then you have the accidents coming in, and then you have the people who are not in the accident, but their relatives coming in, and then sometimes you don't know whose patients, whose relatives, because it's just crowded. So these are things that are done in terms of ensuring that staffing is available. And when the patient comes in, just like everybody, the patients are sorted, triaged, and assessed based on the severity and the necessary investigation. Sometimes might be minor cuts and bruises, you're sent home. Sometimes the persons may be admitted based on the severity of the illness, but everybody is triaged, treated, and transported when necessary.
Okay. And I think that's a very important point or call to action that we can, start to wrap up on, is this concept of, if we utilize the resources properly that we have, we can avoid putting a strain on the resources and therefore allowing allowing people to possibly succumb, because the resources that we have, we put a strain on it for some unnecessary purposes, and then the resources were not able to cover everybody that needed it the most. So just to be mindful of that. It's the same type of call during COVID where we kept saying, prevention, don't follow the protocols in terms of hand washing and, mask wearing and so on, so that you don't have a situation where the system becomes overwhelmed. Once your health system, and in this case, we're talking accident and emergency department, once it's overwhelmed, then people are at a greater risk of having serious health repercussions, right? So we're trying our best. It's the festive season as well. It's a high influx of people at this time. We're trying our best to be mindful and not overwhelm a system so that it doesn't function for those who need it the most.
Because the fact remains that the A&E department is for everybody. And I would say that's a kid. In no way is anything where I'm saying, don't come here. Please. So if that's the impression you got, take it out. But it works best when you use it the way you're
properly,
supposed to
when you
use
use it properly,
responsibly.
Right.
Now, knowing when to visit and utilizing your health centers as well, we have a great primary healthcare system. We have a great primary healthcare team, and each and every one of them, they are trained doctors, they are trained nurses, and they have that they have the
Yeah,
knowledge necessary to manage. And we practice good hygiene, food safety. We can all help prevent these unnecessary emergencies.
Okay, thank you. Let's take this last caller as we wrap up the program. Caller, good morning.
Trudy, something final I want to say. You see, Fairland, he's a cool and collective news, right? I met him once, I had gone for something. And then he explained things to you. Once I asked him one, he's like, I mean, no, you have to do this first. And then, you understand, Trudy? So you understand. So I was saying, there are some people, as you were saying, when you go to your casualty, two people, you there, and a person just come and you see the person going. A person might say, but Mamselle just come, man, and Mamselle, or Mamselle going before me there. So you understand, sometimes, I'm not saying they're not doing, but if you explain to them and say, well, yes, you came after, but her situation is, it's more urgent. I suppose so probably you'll have to do that a little
more explaining. Okay. All right. Thank you, caller. So, Fael, kudos to you again. And, a call. Communication is always key, so people can understand better, the operations of the accident and emergency department. So I will give you your closing words. We are going over our time, so we're wrapping up. But Firelander, you've been a wonderful guest. I give you the opportunity to close.
So I just want to take this opportunity to encourage everybody to stay safe during this festive season. The only way that you'll be able to fully enjoy it is if you do so safely. So don't get yourself hospitalized for any reason, whether it be accidents, whether it be for severe gastroenteritis. Be mindful of that. Also look out for one another. So be careful in those ways. Look out for one another. And let's just make this season a festive one and a healthy one. I want to thank the Trudy and Jacinta, the organizers of Health Vibes, for having me, of course. And also, the final thing I want to say is our healthcare providers, our nurses, as well as our doctors who staff the A&E department, they need your patience and your understanding during this time more than ever. So when going to the A&E department, please think about them. Sometimes the shift gets so heavy that, and I'm telling you from personal experience, you forget to eat, you don't get to drink water, and you put yourself at risk as well. So for the benefit of others. So just be mindful, be patient, and let's have a safe season, and let's have fun.
Nice, thank you.
Thank you so
Great
much.
job and all the best. I mean, I know you said you're on leave, but wishing all the health providers at the A&E department all the best for this season. Patience as well with our patients. But truly, we are thankful for all what you do. We are not taking it for granted. We know that this is a high, how should I say it, a stressful department in terms of what you have to go through and see on a daily basis. So kudos to all the workers in that department.
Definitely. And I want to also say to the pharmacists, just in for like yourself, it is also busy season for you guys as well. Yes, so if I could speak the Creole properly, what is it? Poor God. That's supposed to be like, take courage, hold strong. as you deliver the best to your clients. That's it for us. We're signing out here from Health Vibes. It has been another Wednesday where we graced you with our Vibesy Health program. We hope to, of course, return next week. If God spares our lives, for another program of Health Vibes. In the meantime, do take care of yourselves. Have a great week. We'll see you soon. Bye-bye.
Take care.
Joyce Pharmacy bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your host